Radiographic anatomy, BT&E, and final exam review. So when we're looking at the things we need to know for anatomy, keep in mind it's not necessarily every single little tiny bone that you need to be concerned about, but we do need to make sure we have our foundation set. And foundation includes knowing which long bones belong where, knowing that the humerus is going to be in the front portion of the body. When you laugh, you grab your sides, and so you could grab your humerus. Knowing that the femur is in the caudal portion of the body, knowing where the radius and ulna is, that the ulna is going to be the point of our elbow, knowing the tibia and fibula and making sure you're saying and spelling it correctly. So those are going to be some of our key foundation as far as the radiographic anatomy is concerned. Also knowing our formulas for the spinal column. So knowing that it's C7, T13, L7, S3, and that the tail will vary from animal to animal. Your spinal formula is going to be the same for our dogs and our cats, and even many of our domestic animals will follow. 7 cervical vertebrae is one of those key items that most animals have to have. Very few are going to have variation from 7 cervical vertebrae. Sloths are one. I think there's like one other species that's a big one that I can't remember off the top of my head. Normal thoracic anatomy. This is from a VD radiograph. So the animal is laying on its back with its ventral aspect in the air. And so we should be able to see the trachea, see air in it, and air will always appear black. Same thing in the lungs. They should have black in the airfields within the lungs. The heart should be right in the center. And then we should be seeing the diaphragm as well. If you look in the notes sections of these, it will point out the various anatomy that fits in here. Normal thorax, right lateral. Remember, when we're taking our radiograph, we're typically going to be looking at taking 2 views. A VD and a right lateral is standard. There will be some situations where you need to take 3 views. Some hospitals will have that as their policy. Other times when you're looking for metastasis or valley fever, then we would take a VD, a right lateral, and a left lateral. But our core x-rays that we take are 2 views with a VD and a right lateral. When we have a right lateral, the right side is down, so down against the table. That means the left lung field is what's going to be visible on there, and we'll be able to see the caudal border of the right lung as we look down at it, and keeping in mind 3D, so we're going to have the diaphragm and in between the 2 lung caudal borders. We can see the trachea, and again, we can see blackened area here because it has air. And then the sternum, the spine, the diaphragm, and of course the heart. Looking at a normal abdomen, VD aspect here, we have the stomach, we have the liver, the stomach, the left kidney. We should be able to see the right kidney on some of them. We'll go into that more in a minute, but remember that the right kidney will be cranial to the left kidney, so it's going to have some involvement with the ribs as well, maybe obscuring some of that. And then you can see a gas pattern down in here too, remembering that gas will be black or dark gray. Here is a right lateral of the abdomen. Right side is down. And so in this case, we may be able to see both of the kidneys. The right kidney will be cranial to the left kidney will be caudal. I can even see a little microchip here, but we have the liver, the stomach, the right kidney, the left kidney, and then the spleen. And this body of the spleen will lay mainly on the left. So in this case, with the right side down, we'll be able to see more of the spleen as it goes over the left side of the body. Common joints that we are looking at with our patients, and we'll see joint issues involved with some of these. And so just notice here that we have the bones articulating into that joint. are usually going to be parts of the names of the official names of the joints. Humeroscapular, the scapula articulates in with the humerus, and that will be our shoulder joint. Humeral radial ulnar is going to be the humerus articulating in with the radius and the ulna, and that will be our elbow. Our femorotibial, the stifle, tibial tarsal, the hock, lumbosacral, and the coxofemoral for the pelvis. Normal pelvis. Keep in mind that we're going to need to know the ilium from the ischium. Ilium is going to be more cranial, ischium is going to be more caudal. And so when we have an animal here that's laying in the ventral dorsal positioning, we're going to see the wings of the ilium up at the top. We have the acetabulum, that's the cup that the heads of the femur sit in. We also do need to pay attention to the greater trochanter. When we're doing a lateral radiograph, this will be where we're measuring is the greater trochanter as it juts out from the head of the femur. The ischium are going to be the parts that wing down underneath the acetabulum, and then we have the femurs as the main long bone there. The obturator foramina, those are going to be the holes in the pelvis that we see. So they should be even, equal of size as we position. And one of the things with normal pelvis positioning we need to look at is we need to keep the whole body straight, and it starts with the head. If we're not keeping the head and thorax straight, the pelvis will not be straight either. And then we want to make sure that we keep the legs nice and even as well, so that way we can keep the obturator foramina even and we'll get a good diagnosable radiograph. When we are taking the pelvic x-rays, if we are able to fit, veterinarians often like to have the stifles in there as well. And you can see on this radiograph, we do not have the stifles included. Very large dog, I'm assuming. But on anything where we are able to fit it in, it is suggested to have the stifles in, and we want to have the patellas on top. So that way it looks kind of like if we cracked an egg and the yolk is right in the middle, that's where our patella should be if we have them nice and straight. And we may need to rotate in medially to get the patella on top. This is a really good one that shows the positioning, including the stifles on there. So, you know, for comparison's sake, you're able to see the anatomy as we're looking at this. The epiphyseal plates is another one that we want to keep track of for puppies or kittens. So any of our young animals, these are going to be made of cartilage. So these are growth plates, and this will be more transparent. We're going to see often a dark shadow between the epiphysis and the diaphysis. And these will often fuse, depending on the size of the animal, between 12 and 18 months of age. And then last, as far as our anatomy goes, here is the normal pelvis. And in this case, this is a left lateral, for example. So left lateral, the left side is down against the table. Anytime we are positioning these, we'll go into positioning later on, but we're going to want the down leg to be forward, the dependent leg goes forward. So in this case, if we have a left lateral, the left side is down against the table, the left leg will be on the bottom, and we want to push that going forward in a running position. We have the ilium up at the top, acetabulum. We like to see these as overlapping as we can. We have the two femurs, and then we have the obturator foramina, which will be smaller and overlapped again, and then the point of the ischium will be pointed out as well.